Bioinductive patch for rotator cuff repair. Rotator cuff tears are a common cause of shoulder pain, and while surgical repair is effective, retear rates remain a significant concern, especially for large or massive tears. A promising innovation is the bioinductive collagen patch, like the Regeneten patch, which promotes tendon-like tissue regeneration and reduces retear rates. A recent meta-analysis shows that the bioinductive patch significantly improves patient outcomes, with ASES scores increasing from 44.6 preoperatively to 96.3 postoperatively, and retear rates dropping to 8.3% for full-thickness tears, compared to 21% in traditional repair. Tendon thickness also increased by 12 to 44%, demonstrating enhanced healing. While overall complications are similar to traditional repairs, partial thickness tears showed slightly higher complication rates. Despite these promising results, more high-quality randomized trials are needed to confirm its benefits and cost-effectiveness. In summary, the bioinductive patch represents an exciting step forward in improving outcomes for rotator cuff repair, offering patients a better chance of durable recovery.